Hey everyone, so today we're going to go through a very simple but powerful change to your foot and ankle isometric strategies, particularly when we're working with Achilles tendon issues, and particularly when those Achilles tendon issues are coupled with a foot that's more supinated and more rigid or expressing less movement options. Okay, so when we're working with any kind of client and we're identifying their current capacities, we always want to try and identify the qualities that their anatomy is not able to access and handle load through. Okay, because that's ultimately what we want to try to facilitate to restore movement options to the system. When we're working with Achilles tendon issues, because we're going to talk about this foot and ankle isometric within the context of Achilles tendon pain, Achilles tendon issues, and how we can progress the loading of that, or at least load the Achilles tendon and the plantar flexors in the early stages. We need to consider the behavior of the tissues and segments around the foot and the ankle, particularly on a kinematic level. So how the joint segments are interacting with each other to support the distribution of workload, to support the distribution of force across the foot and the ankle tissues. Okay, so early on, we're not necessarily going to put a huge amount of load into the Achilles and the plantar flexors when the foot's biasing more of a dorsiflex position, because that's going to put a lot of load through the Achilles. So what we can do is we can manipulate the foot and ankle position relative to the tibial position by changing how we organize the body and put load through the foot and the ankle during an isometric strategy. But we also want to start to incorporate certain changes on a kinematic level to work towards restoring those movement options, or restoring a more adaptable, more pronated foot position, which will allow us to express more movement options. But we can't just go from a supinated rigid position directly into a pronated, more adaptable position. We have to slowly work towards that. So again, if we're working with Achilles tendon issues, we want to expose the tendon to more load. We want to expose the plantar flexors to more load. But we want to try and consider the kinematic, the joint segmental coupling across the foot and the ankle. If the foot is biasing more of a rigid supinated position, which represents less movement options, we want to try and slowly encourage more of a pronated position. But pronation of the foot will couple with dorsiflexion of the ankle and calcaneal eversion, which will all encourage a bit more load through that Achilles tendon, which we might not want to expose the tendon to early on. So what can we do to bias or shift a little bit more pronation behavior into the foot while still reducing the amount of load into the Achilles tendon, but getting load into the foot and ankle as a whole? What we can use is a toe flexion biased foot and ankle isometric strategy on a foam roller, because when we load the metatarsal heads on the foam roller, what that will do is it will encourage a lifting of the metatarsal heads, which will encourage a little bit more pronation at the foot, while still allowing us to get that extension of the foot segment to get some load through the Achilles and the plantar flexors. And during the way we're going to set it up, it will allow us to load the foot and the ankle whilst biasing a little bit more of a negative shin angle. Okay, so we're not encouraging too much dorsiflexion, but we're still biasing a little bit more of plantar flexed ankle, but slowly exposing the ankle to more and more dorsiflexion as we progress. So just before we go to the exercise, just to show you how the foam roller helps us, as we load the metatarsal heads onto the edge of the roller, the shape of the roller allows us to nicely flex the toes gently over the foam roller, facilitating this lifting of the metatarsal heads, whereas if we extend the toes, you'll see how this pulls us into more supination. So to load the foot on the foam roller with a toe flexion bias and without a lot of dorsiflexion, we'll need to use this door frame constraint to limit the movement of the trunk and the foam roller. And this position really helps us to isolate the load at the foot and the ankle without having to worry about controlling the trunk position, but it also gives us a really nice option to load the ankle without too much dorsiflexion. So we're going to keep a slight negative shin angle bias here, so we're not encouraging too much dorsiflexion, and then lift the opposite leg and challenge the isometric capacity of the plantar flexors here. And we need to ensure that the toes don't extend, because this is something that you'll often see in your clients, especially when they hold for longer periods. And so this is certainly more of a detailed foot positional setup. When we're working with sensitive tendon issues or any kind of sensitive foot and ankle issue, it's important to appreciate how the joint segments are behaving as we drive load into the tissues. So we can start here with a 30-second isometric hold and work towards 60 to 90 seconds.